So I see that you're interested in a head-to-toe sensory examination today.
Yes.
Okay. So what made you book this appointment with me?
Recently I've noticed I have some numbness in my abdomen.
Okay. Can you point to it?
Yeah, it's sort of my upper abdominal.
Okay. Can I just feel? All right. Do you feel me touching you now?
Yes, but it's very light. Like I don't feel it very much.
Okay. Well, I'm not feeling any obvious masses, lumps, or bumps. Okay, so upper abdominal, loss of touch. Okay, and when did this begin?
I think a couple days ago is when I noticed it.
A couple of days ago. Is this sensation or loss of sensation accompanied by any pain anywhere in your body, any tingly sensations, pins and needles?
I guess sometimes it feels a little pins and needles, but it's mostly just the loss of feeling.
Okay. Does this radiate anywhere else? In your lower back, your spine, fingertips, or toes?
I don't think so.
Okay. Are you on any new medication, Mary Rose?
No.
Okay. Any headaches, loss of hearing, blurred vision?
No.
Okay. And what were you doing when you first noticed this?
Well, I was outside and a breeze blew by and I noticed that I felt it everywhere except for my stomach.
Okay. And I assume you weren't wearing anything covering your abdomen.
It was a crop top.
Interesting. Okay. Have you had any major surgeries this year? Anything I should be aware of?
No.
Any joint pain?
No.
Back problems?
No.
Okay. Any difficulty breathing? Feeling like you're about to go out of breath? Feeling like you can't just, you're gasping for air?
No.
Okay. And how about any feeling of lightheadedness and, any... No?
Mm-mm.
Okay. Have you noticed a dry tongue or a dry mouth?
No.
Okay, so what I'm going to be doing is a sensory examination of your abdominal area, and I'll focus on the skin in your abdomen and the dermatomes. And I'm also going to focus on just the nerves that power the rest of your body, and do a sensory examination on your arms and your legs as well, to make sure that there's nothing neurologically wrong with you that we should pay attention to.
Okay.
All right, so I'll go ahead and put on my gloves. This video is sponsored by Manta Sleep. Sleep better anywhere, anytime. Manta Sleep empowers light sleepers to sleep better and live more. Manta Sleep masks are 100% blackout for deeper sleep and fully adjustable for a personalized fit. Made of soft, breathable, and durable materials with ventilation for unmatched breathability and comfort. I'm a side sleeper, so I got the Manta Silk Sleep Mask. I got introduced to the luxury of pure silk for deep, revitalizing sleep. I can go back now. I love this mask because it has tapered eye cups for side sleep comfort. The eye cups are made of 100% pure 30 mommy silk, and they are so gentle on the skin and help prevent wrinkles. The 22 mommy silk head strap offers a perfect fit that stays in place all night long. This mask will enable you to achieve true 100% blackout for a deeper sleep. It puts zero pressure on eyelids or eyelashes, and it's infinitely adjustable for a personalized fit. The 22 Mommy Head silk strap offers a perfect fit that will stay in place all throughout the night. I also got the Manta Sleep Cool Eye Cups, freezable eye cups to soothe the eyes and sinuses, and the Manta Sleep Steam Eye Cups, which are microwavable eye cups that help moisturize and refresh your eyes. Check out Manta Sleep by clicking the link in the description down below and use code LUNALUX at checkout for 10% off your order. You will achieve an amazing night's sleep as well as help this channel out, so click on the link in the description down below. Thank you, Manta Sleep, for sponsoring this video. Sleep better, anywhere, anytime. And I'm just going to palpate you from this position a little more deeply, and I want you to tell me if just sitting like this, if you feel any pain.
Okay.
Okay, so I want you to kind of push yourself back like this with your hands and lean back a little bit, yes. Okay. Okay. Do you feel me doing this?
I do. There's no pain, but I feel it very lightly.
Okay. And do you feel me touching you now?
Yes.
Okay. All right, you can come back up now. I'm gonna check your vitals and get a good baseline of your heart and your lungs. Okay. And you can just breathe normally. I'm hearing S1 and S2 for sure. Good steady rhythm, not hyperdynamic, and I'm not hearing any extra sounds. Good. And I'm going to also listen to your lungs. And you're not a smoker, right?
Correct.
Good. Lungs are clear. I'm not hearing any wheezing or crackling, no signs of any bronchitis. And I'm also going to check the base of the lung in the back. Okay, good. And over on this side. Good. So lungs are clear. I'm gonna go ahead and check your levels of oxygenation. Okay, good. You can keep that right there. And I'm gonna take your temperature and I'm going to insert this slightly inside your ear. .5, perfect. .99% oxygenation and 76 beats per minute. Okay, I'm gonna make a note of these. going to ask you to lay down and I'm going to take a look at your tummy.
Okay.
Okay, Mary Rose, are you comfortable?
Yes.
Okay. Is it okay if I raise your top a little bit and unbutton your pants? Okay. Go ahead and just relax. And I'll begin by doing a visual inspection of the abdominal area. Okay. I'm also going to check your chest and your neck, as well as your shoulders. Face, arms. Okay. I'm gonna go ahead and auscultate the abdomen. I'm paying attention to any swooshing sounds. I'm hearing activity consistent with normal digestion and no extra sounds, no gurgling or swooshing sounds. Okay, good. I'm also going to check for the presence of any bruit on the carotid artery. No bruit present. Okay. Let's see, do you feel me touching your belly button?
A little bit.
Okay. How about now?
Yes.
All right. Just going to inspect the belly button area. And I'm gonna need to bring in extra light. And no discharge, no redness, no signs of any inflammation. Do you feel any pain here?
No.
Okay, good. I'm going to do a light palpation and check the sizes and shapes of your internal organs and also see if I can detect any masses. So go ahead and just breathe normally. Checking the size of the liver, and the tip of the liver is barely palpable, which is good. Not enlarged, normal size and shape. Okay. All right, I'm going to do a light percussion and check for the type of resonance that I'm hearing from your internal cavity. Okay, that's good. Good. I'm looking for dull, very bass sounds. Good. gonna do the same on your chest. Good. All right. I'm gonna take a couple of measurements. And across we have 37 centimeters from the belly button to the top here of your clavicle, 38, and to the shoulder, okay, 46, exactly 46. Good. So normal symmetry, the proportions are respected. Okay, let's do a quick sensation test, and I want you to tell me if you feel a cold feeling on the right side of your abdomen or the left side.
Okay. Right.
Good.
Left.
Good.
Right.
So that was quite a strong feeling of coldness. Let's try something much more subtle than that.
Right.
Good.
Left. Right. Left.
Okay. And how about this?
Right. Left.
Okay. Very good. And let's try a hot sensation as well.
Right. Left. Right.
Good. And now left or right shoulder.
Right.
Good.
Left.
Good. Okay, so I'm not concerned with the dermatomes in your abdomen, not noting any masses, normal internal sound activity. I'm gonna focus on your face next.
Okay.
And continue checking the cranial nerves. All right, let's start with the eyes. And I want you to just look up for me. Okay. Good. Good. So pupils are round and reactive to light. Can you continue looking up for me? I'm going to take a look at the conjunctiva. Good, pink and moist. Good, pink, and the sclera is white. The arteries look healthy. Gonna go ahead and check the back of your eye as well. Can continue looking up. Perfect. Optic disc looks intact. Retina does not present any lesions. Good. Optic disc is intact on your right eye as well. Okay. I'm going to just palpate your sinuses and your face and your lymph nodes. Have you noticed any lumps or anything concerning your body?
No.
Good. So I will start with the frontal sinuses. Good. Checking for any indentations, any lumps, any congestion. Okay, good. Any pain there?
No.
Any pain there?
No.
Can you open your mouth slightly? Slightly? Yeah, perfect. I'm gonna tap on your jaw. Okay, any pain?
No.
Okay, I'm gonna press down on your mastoid bone process behind the ear. Okay, good. And checking your head. Looking at the back, at the top of the cervical spine, I'm feeling for any lumps, bumps, and any pain. Good. The head is symmetric and no indentations. Okay. Can you move your head towards your right side? I'm going to take a look at the cervical lymph nodes here. Checking for any swollen lymph nodes. Good, and over on the other side. Good, no lymph nodes enlargement noted here either. And can you shrug up for me? Perfect. All right. So let me take a look inside your ears as well. And then we'll do a hearing test to make sure that the cranial nerves that control your hearing are intact. You can continue looking towards your right side. I'm gonna just take a peek inside the ear canal. Okay, good. Bony landmarks are present. I see the tympanic membrane, pearly gray, no discharge. Good. And over on this side. This ear canal is a little bit more narrow. Okay. All right, same observations. A little bit more wax buildup here, but in the normal amount. Good. So no concerns with the physiological state of your ears. Let's go ahead and do a couple of hearing tests. Keep your eyes closed and tell me if you hear a sound with your left or your right ear, okay? Let me get my device. All right.
Left.
Good.
Right.
Now can you point towards the sound? Good. 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 Perfect. All right, then let's try something a little more subtle. Can you tell me if the sound moves towards you or away from you?
Towards.
Okay. And how about now?
Away.
Perfect. All right. And let's check the dermatomes of your face as well. I have a hot and a cold object. You can just say hot or cold.
Hot.
Good.
Cold.
Very good.
Cold. Cold.
Good.
Hot.
All right. Good. All right. And now I'm going to put some slight pressure on the bony prominences of your face and chest. And I want you to point to where you feel me touching you. Good. 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 Very good. Okay, so let's go ahead and check your legs and your feet as well. Okay. All right, Mary Rose, let's take a look at your legs here. And okay. All right. So I'll be doing a visual inspection first. Capillary refills within 2 seconds, which is normal. Checking for any edema signs, any water retention that's above normal. Ooh, your feet are quite cold. Is that normal for you?
Yeah, usually they get cold.
I can feel the coldness through the gloves. Okay. Can you tell me where I'm touching you?
My big toe.
Okay, left or right?
Right.
How about now?
Other foot left.
Okay. And how about now? Where am I touching you?
Right heel.
Okay, now?
Left heel.
Perfect. All right, I'm going to check your pedal pulses. 2.5 and synchronized. Good. All right. Gonna check for any abnormal neurological reactions upon tapping. Good. Okay. I'm also going to check your popliteal pulse by the knee. Okay, good. And I'm gonna check the nails for any pitting or clubbing symptoms that may indicate hypothyroidism, and genetic conditions that are abnormal. Okay, no signs of any clubbing or pinning. That's great. Okay. All right. Can you push into my palms with the top of your... Good. And now with the knees as well, can you push into my palms? Perfect. All right. Okay, let's do a couple of neurological tests. Okay, I'm going to touch you with an object and I want you to tell me when you stop feeling the sensation.
Stopped.
Good.
Stopped.
Good.
Stopped. Stopped.
Good. Okay, I'm going to touch you with something sharp and I want you to say yes when you feel it.
Okay. Yes. 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 Yes.
Good. All right. And I'm going to touch you with something soft. And I want you to tell me if you feel the sensation on your left leg or your right leg.
Okay. Left.
Good.
Right. Left. Right.
Good. Okay, I'm going to take a couple of measurements. 6.5, 6, and I'm going to check your ankle for any inflammation. We are at 8 here. And we're exactly at 8. Okay, so no inflammation of the ankles, no water retention, nothing abnormal. And I want you to flip face down so I can do the Babinski test on the bottom of your foot. Okay, it's good.
Kick the microphone.
Okay. Do you feel me touching your calves? Okay, good. And do you feel this?
Yes.
And this?
Yes.
Good. All right, let's do the Babinski test. And perfect. Perfect. Okay. So Babinski is negative, no neurological signs of anything abnormal. And not seeing any signs of edema on your calves. Plantar region looks normal. Can you wiggle your toes for me? Good. All right. You can come back up now. Okay, Mary Rose, I did a very thorough investigation. I took a look at your abdomen, the cranial nerves. I checked your eyes, ears, and your feet and your legs. I'm going to take a couple of notes of the fact that there were no positive neurological findings. So everything checks out. Now, cranial nerves are intact and Babinski test was negative. The abdomen did not present a loss of sensitivity in the dermatites. Okay. So let's monitor that loss of sensation that you said that you feel. And and let's come back in a couple of weeks and see where we are.
Okay.
Do you have any questions for me?
I don't think so, no.
All right. Great seeing you today.
Good seeing you too.